Healthcare reform. We've all heard the words, and we know it's coming. But what will it mean for you and others in North Carolina who purchase their own health insurance? Because you're a valued Blue Cross and Blue Shield of North Carolina member, we want to take a few minutes to provide an overview of healthcare reform. Our goal is to give you the information you need so you're prepared for the upcoming changes. We'll explain the Affordable Care Act and some of the terminology that comes with it. Words like grandfathered plan, subsidies, and the health insurance marketplace. We'll also tell you about our exclusive online tool called Blue Map. It gives you a personalized overview of how healthcare reform may affect you. Let's start by understanding a little more about the Affordable Care Act, or ACA. It's the law passed by Congress to make healthcare more affordable and accessible to everyone. It levels the playing field, so there are no preferred rates based on gender or health status. Some people may pay less, others may pay more. The government now mandates that every individual have health insurance or incur a federal penalty. One big benefit of ACA is it ensures that people with pre-existing conditions are no longer denied coverage. Additionally, it requires that every new 2014 health insurance plan must now cover what's known as essential health benefits. Think of these as the minimum set of health benefits required by law. Your current plan already contained many of these benefits, but those that are new or expanded, there are quite a few, are highlighted here. All of these benefits are included in every new 2014 plan. ACA also caps out-of-pocket expenses to protect people from high, unexpected medical costs. It's important to know healthcare reform will affect everyone differently. That's why we created Blue Map. It's an online tool that takes the confusion out of healthcare reform. It shows how ACA may affect you based on your unique situation. Let's start by looking at the type of plan you currently have. There are two scenarios. If you're an individual who had your current health insurance plan on or before March 23, 2010, the day ACA was passed, you have what's known as a grandfathered plan. If you like your grandfathered plan, you can keep it. For many, this will be in your financial interest. You also have the option of switching to a new 2014 plan. But compare plan differences carefully. Once you leave a grandfathered plan, you cannot go back, and for many, this may mean higher premiums. If you don't have a grandfathered plan, you're considered non-grandfathered, and you'll need a new 2014 plan. If that's the case for you, we'll automatically map you to a 2014 plan that most closely matches the benefits of your current plan. Your new plan will meet the requirements of ACA. Although we'll automatically map you, you should be aware that there could be a lower-cost plan, or one that better fits your health insurance needs. That's exactly where Blue Map is most valuable. It helps you understand all of your options. An important part of healthcare reform is the introduction of federal subsidies. They are the affordable part of ACA, making health insurance more accessible to more people. Briefly, there are two types of subsidies: advanced premium tax credits and cost-sharing reductions. Advanced premium tax credits are sent monthly, directly from the government to Blue Cross and Blue Shield of North Carolina, thereby reducing your monthly premium. Many Americans will qualify for premium tax credits, including the middle class. Qualifying for subsidies will be based on family income and family size in relation to established federal poverty levels. For example, an individual with an income of $45,000 or a family of four with an income of $94,000 will likely qualify. Blue Map can give you an estimate of what you might receive in premium tax credits. It is important to note that you must apply for them. We'll show you how. Cost-sharing reductions will benefit more modest incomes. They help lower out-of-pocket expenses, such as deductibles and copays. To qualify, you must choose a silver metallic plan. We'll talk more about metallic plans later. You essentially pay for a silver plan, but receive the richer coverage of higher premium plans. For example, let's say you go to the doctor and are charged $100. Normally with a silver plan, you might have a copay of $25. But because you qualify for cost-sharing reductions and chose a silver plan, you may have a copay as low as $5. Cost-sharing reductions can lower deductibles too, say from $2,500 to $500. And you can take advantage of both cost-sharing reductions and premium tax credits at the same time. Lastly, know that subsidies do not apply to grandfathered plans. They can only be applied to new 2014 plans. Of course, many people simply won't qualify for subsidies. That's why we're creating lower-cost options. These plans can ease the impact of higher premium costs due to healthcare reform. Healthcare reform also brings about the creation of the health insurance marketplace, also called the exchange. It will work much like an online travel site, letting you shop and compare plans, so you can get the plan you want at a price you're willing to pay. To make it easier to compare, plans will now be grouped by metallic levels: bronze, silver, gold, and platinum. As you might imagine, a gold plan provides more coverage than a bronze plan, but at a higher cost. Benefits at each plan level will be similar, but there are other factors to consider as well. These include doctor and hospital networks, customer service, and availability of wellness programs. The Blue Cross and Blue Shield of North Carolina plan you buy on the exchange is exactly the same as the plan you'd buy directly from us. Same plan, same price. Okay, take a deep breath. We've shared a lot of information with you. If it seems confusing, that's exactly why we created Blue Map. This powerful online tool does all the heavy lifting for you. Just answer a few simple questions and complete your Blue Map so you know your options on how to move forward. The annual enrollment period begins October 1st, 2013. If you do want to make any plan changes, you must do so by December 15th, 2013 for an effective date of January 1st, 2014. In addition to Blue Map, we have personal reform advisors to assist you. Just call them. They're ready to talk one-on-one and answer all your questions. So, how will you be ready for healthcare reform? Start by taking the Blue Map. It saves time, eliminates confusion, and it could show you how to save money. Then, look for your rate letter in September, detailing what plan you'll be mapped to and what you can expect to pay in 2014. Healthcare reform will be different for everyone, but we're here to help you make sense of it all. Blue Map has the answers you need based on your unique situation.